Okay, so good afternoon to all. Am I audible? Am I audible and can you see the screen? Please reply.
Sir, yes, sir.
Okay. So today we are going to see one of the lesser known or very lesser used remedy, Absinthium. And to the best of my knowledge, we are unable to use these smaller remedies because many a times we do not have known about those exact indication of these remedies, or we are reluctant to use such a remedy. So it's my small attempt to let you know about all such a remedies. So today we are going to see the remedy Absinthium. So what Absinthium is about? So Absinthium. Okay. So a famous liquor which is called as absinthe, it has been prepared from Artemisia absinthium is the plant, and from that plant, this liquor is prepared. And in France, if you see, as like in our India, what we call that desi daru, not desi daru, but gauti daru. So they prepare that gauti daru from jaggery and some chemicals, and it is hazardous in comparison to whiskey or wine, whatever we get in markets. So the on the same principles, this absinthe is prepared, but it is prepared from this plant, but it's more harmful to the people who are drinking it, uh, and they have more toxicological or poisonous symptoms after taking this liquor. So it is more harmful than that, and it has produced some symptoms of poisoning, and from that it has come to us the potentization, the proving, and it has been come as a remedy in homeopathy. So I have known about this remedy before learning from Sarkar sir, but Sarkar sir has indications which are yes, they are written in books also. So in epileptic attacks, the patient will forget after attack of epilepsy. So what will happen with him? He doesn't remember after attack of epilepsy, with tendency to fall backward. Whenever he gets convulsion, he has a tendency to fall backward or bend the head backward. Then severe depression or hopelessness after physical injury. So these are two indications by Dr. Sarkar sir, along with the character of epilepsy, uses this remedy a lot. While studying for this today's webinar about this remedy, I'm unable to find this thing that patient is a severe depression or hopelessness after physical injury. So now we can have such a indication for sure now to use. So what type of conversion these patients will have? So always see what we do in cases of menses. We divide the symptoms of menses as like before, during, and after menses. So what happens? We need to divide all those cases on in that line only. Means whenever you are trying to select a remedy for the case of epilepsy, so try to see what happens before epilepsy, what happens during epilepsy, and what happens after epilepsy. So I have divided these three symptoms, these three parts of convulsions. First is before convulsions, what will happen? So patient will have nervous trembling, then distorted features, then equally dilated pupils. Please remember this: equally dilated pupils before the convulsions. He is obliged to walk about. So पेशेंट रेस्टलेस होगा, नर्वस ट्रेमलिंग होगी. ट्रेमलिंग में आपको ये रेमेडी में ट्रेमलिंग में आपको हर जगह पे मिलेगी. टंग बाहर निकालेगा तब भी ट्रेमलिंग रहेगी. जबान इतनी जाड़ी मोटी लगेगी पेशेंट को कि वो बाहर निकलने के लिए भी दिक्कत देगा। सो इस तरीके से पेशेंट में दिक्कत रहेगी, राइट। तो वी नीड टू फोकस ऑन सच ए थिंग। कन्वर्जन कैसे रहेगा, तो लार्ज नंबर के कन्वर्जन रहेंगे, मतलब एक दो तीन चार, एक दो तीन चार सात आठ दस, ऐसा कंटिन्यू पेशेंट कन्वर्जन में जाएगा। कन्वर्जन रुकने का नाम नहीं लेता है इन रैपिड सक्सेशन। अभी इस कंडीशन को हम लोग आज के मॉडर्न मेडिसिन की लैंग्वेज में हम लोग बोलते हैं स्टेटस एपिलेप्टिकस। ये रूब्रिक आपको फाटक रेपर्टरी में भी मिल जाएगा। So during this conversion, patient will have screaming also. He throws head backwards and bites tongue. So he will bite tongue also during this phase of conversion. His jaws will be fixed. That's why if tongue comes in, he will bite his tongue. Then he will have frothing at mouth. A large number of convulsions appear in a single day. So you will get a history if patient will not have any convulsion for many days together, and when he gets those convulsions, he will have convulsions in a day at many times, and each convulsion will have the it will last for longer period. Consciousness it is not entirely lost. In some mathematical you will see unconsciousness during convulsion, but one mathematica, I'm forgetting the name of mathematica, but these are the cases where patient will not the consciousness fully. Patient will have insensible, means he is not remember, he is not getting what type of complaints he is going through. So Secuta is one of the remedies under that you can think of. Then along with this convulsion, patient may pass his stool involuntarily, or he may discharge his image involuntarily. After convulsion, he will have forgetfulness that we already have seen. Forgetfulness will followed by idiocy, and then he will have unequal pupils after epilepsy. So what we have seen, before epilepsy, both pupils are dilated. After epilepsy, the pupils are unequal. Means one may be normal, one may be contracted. One may be normal, one may be dilated, or one is contracted, other is dilated. There is one term written in under this remedy, and that is infantile spasm. So we need to understand these terminologies written in our Mater. What do you mean by infantile spasm? So what happens in infantile spasm? Patient will have sudden stiffening or body tensing, arcing of their back. So stiffen body जो है that will get arc. He will bend arm, leg, head forward. Grimacing of face. During epilepsy, you will see these types of grimaces on the face of patient, and before epilepsy, you will see that restlessness which will oblige the patient to walk around. So under infantile spasm, you will see nodding of the head repeatedly, pulling their head to one side. These are the symptoms you will see in infant. May I know what is the age we will consider under infantile age? Since how many up to how many months or up to how many days you will call a child as an infant according to medical science? Please do type that age limit in chat box. I will be happy to see that. Then rolling of eyes upwardly. These movements are often appear in group of clusters. There are short pauses of 5 to 10 seconds between each spasm. Why I am telling you this about infantile spasm? Just give me a minute. Huh? So what happens now if we know the terminologies, if you see this symptom, many of the parents, many of the mothers may miss, and many of the doctors may miss this type of symptoms because as we have seen that only one person knows 6 months. May I know what is the age of which is the age to which we will call as a infantile age? We are 22 doctors over here. I want answers from you people. Otherwise, I have just now started about this activity. I don't claim that uh, I'm that much knowledgeable, but I should stop sharing on this platform if I get such a poor responses from you guys. So there are short pauses of 5 to 10 seconds between each spasm. Where I was at the many of the patients, mothers or parents will miss about this thing that their child, the infant is going through that spasm, and it's a abnormal thing. If as a doctor you don't know to whom you are going to call infant, as a doctor, if you don't know, okay, these are the symptoms where you need to be serious. You need to think about the diagnosis, about the fate of that child. Then it will be a serious crime on your behalf. There is one more term that is epileptiform seizure. So these are the seizures which will synchronize with EEG. तो EEG के रिपोर्ट के साथ में epilepsy जो आती है that will match. These patients have tremors at general level. This medicine is said to cure poisoning by mushroom. So if you get some case, you can think of using this remedy. And so nervousness, excitement, and sleeplessness in children you will see. Restlessness will be there at night, but children will not tell you about those disturbing dreams. But these symptoms you can see in cases of adults. Then they have constant desire to pass horrible, odorous, and deep yellow colored urine. So you will see these symptoms in adolescents or who have passed the age of childhood. Darting pain in right ovary, premature menopause. So I will show you what Dr. Patak Repertory says about this premature menopause. So they have sudden and severe giddiness. So you can correlate this remedy with whatever liquor they are preparing for those plants, and it is causing uh, the symptoms, toxicological or those symptoms after taking that liquor. Then they will have sudden and severe giddiness. You may see the history of worms. So I have quoted this remedy as a remedy for epileptic fits in children. So we have seen how the fits occur. We have seen the nervous, excited, sleepless children. We have seen epileptiform seizure. We have seen status epilepticus. We have seen urine of those. We have seen sleep pattern of children. So again, we are here that we are now at the age where there will be menopause, and now we will see what happens at young age. So darting pain in right ovary in female side of the young age or menopausal age. Sudden and severe giddiness. Worms you will get in cases of pediatrics. Patient will want to lie down with head low position due to headache or routinely he will lie like that. Then obstinate autumnal fevers. Escape for this thing with hepatosplenomegaly. This remedy is the gem remedy. It consists of all those three stages of fever, that is chill fever, chill it and sweat. But patient will be sleepy during fever stage. The patient of absinthium will have vertigo on rising with tendency to fall backwards. You will find constipation in these cases. Then otorrhea, especially after one-sided headache, you will find in this medicine. Then this is important. This medicine brings on menses in adolescent or young females who are anemic, but you are not going to use it in each and every case. You can correlate. This age of female comes to you with pain in right ovarian region, with she is having some trembling, or with she is having some convulsion, then you can definitely think of using absinthium, but not only on one indication. So if we see the adults, so in adults, you will get undermined. They will be loquacious. They will be frightful hallucinations. They may see various color of rats. You will get this rubric in synthesis. The patient have illusion that he sees many color of rats are all color of rats. Then delirium will be there. Kleptomania will be there. So idiotic, we have seen that these patients are idiotic. So how idiotic they are, they doesn't care uh, whether she dies or not, or he dies or not. Means if he is taking alcohol, he will continue with that one. They are insane. Then they are brutal. So super alternating with violence. We will see the rubrics to explain it more. Then they will have horrible dreams, compelling the patient to walk about in great distress, seeing all kinds of vision. As like I have said, that in one rubric in synthesis, you can see that they are seeing all types of rats. So next, vertigo. This we have already seen. Okay. So now the last part about this remedy, and that is repertorial insight. So if you search in Phatak repertory, you will see many rubrics which this remedy covers. But single remedy rubric I have selected for you. So if you see the rubric menopause premature, you will get single remedy absinthium in that. Then ear discharges after headache, single you will get this remedy. Then face foolish look, idiotic we have seen now. So single remedy Dr. Phatak sir writes and that is absinthium. Then heartbeats heard back in. This I forgot to tell you in Mater but heartbeats that are felt in the back. Single remedy Dr. Phatak sir writes. Then insanity, mania, craziness, brutal. So brutal type of insanity and mania the patient will have. That patient is of absinthium. I have seen Sarkar sir using this remedy in cases of epilepsy where the sir gets such a type of brutal things in cases. I exactly don't remember a case, but I have seen that case of Sarkar sir in Balkalyan in Pune. So the boy was not मतलब उसमें ऐसे था कि he is in the habit of throwing, breaking the things, and then tearing his clothes. So for tearing clothes, sir, I had given some remedy before, but after that, these symptoms were remaining, and he was on some anti-epileptic medicine. And sir had given absinthium, in that case, in follow-up, improved a lot. Personally, I don't have any experience which I can share with you, but in one of my case, the remedy is right now. I have given, but I have not got the follow-up of till now. Then under T trembling, then next rubric is T trembling, uh, tremors, convulsions before. So along with veratrum, we read absinthium you will find. So this trembling is the generalized thing for absinthium. And then if you see, I think this is the rubric from synthesis. So under mind, unconsciousness, stupefaction, alternating with violence. So this is single remedy in synthesis. Yes, it is in synthesis. So patient will be unconscious. He will be stupefied means in semi-conscious. If you try to arouse him with force, then he will get aroused. Otherwise, he will be sleepy. And that alternates with violence. If you see in such a cases, synthesis like bigger repertories has mentioned only this remedy in that rubric. Phatak sir also writes insanity, mania, craziness, brutal may single remedy, and that is absinthium. So I hope you have known about this remedy before also. But this is from my side. This is my small effort to let you know about these remedies so that you can uh, you can know their indications. You can definitely try using them in your practice. About potency, uh, I have 30 201 m with me. In my case, I have given 1 m directly because it was a clear cut case to be indicated of absinthium, as like physicals we have studied now. So constipation was there. So like that, and this type of convulsion. So this is typical because that my patient is on five drugs of five antiepileptics, and all the time whenever he gets fit, he will get like that only status epilepticus in spite of taking those five medicines also. So let's hope for the best. If I get any follow-up or results in that case, I will definitely share with you in any of the upcoming webinar. I will try to conduct small webinars on smaller remedies, especially from Boris. Hope you will all join. Those who have missed the session, I will upload this session on my YouTube channel, and all of you can watch again whenever you want. And thank you all. This is all from my side. If you have any queries regarding this session, you can definitely ask me. I have very short experience about this. I need to do these sessions as an interactive sessions. If there is no interaction, then it's a one-sided lecture what we were mostly attended in our college days. So the two participants are right the age of infant up to 1 year from 1 month. That is the perfect answer. This is the age where we call them as an infant, as an infant. So thank you all. We'll see you soon, and we'll meet in the next meeting. If you have any queries, you can ask. Otherwise, we'll end the meeting. And if you like, you can definitely share the channel with your friends. And like if you think that it is adding some value to your knowledge. So thank you all. I think no one has any queries. Sure. Bye. Good day.